Good afternoon. This is Dr. Aparna. I am your emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, edupreneur, and medical writer. In my pursuit to address, promote, and propagate Ayurveda and psychotherapy globally, I come up with one topic every week or thrice a week on excuse either Ayurveda or mental health or psychotherapy and related topics. So this session is a continuation session on OCD. Last session we had discussed about what is OCD, what are obsessions, what are compulsions, with examples and case studies, the full cycle of OCD, what are the causes of OCD, what are the types of OCD, and how to this session we are talking on the management or the treatment of OCD. So if you want to know more about OCD, please refer to my previous session. The links will be in the description. And also I'm getting requests for that they people, most of you and a few of you want workshops and webinars on the topics of mental health aspects and Bhagavad Gita and Ayurveda. So it is coming soon. It will take some time, but it is coming soon. I will come with some workshops and webinars, so stay tuned. So let's get started. Today we are discussing just the recap of what is OCD for who have missed the last session, and what are the effects of OCD on the body and mind in general, and what how to manage OCD. How do we manage in our setup? How do I manage, and how is it managed in general? And some self-help strategies that might be useful for the people suffering from OCD. See, OCD at the outset or at the onset, it might look that this is not very severe or very complicated. However, it becomes complicated over the period of time. It can only be explained by people or understood by people who are suffering through OCD, because their personal, professional, and emotional life are going to get disturbed. So, it is complicated, but it doesn't seem to be complicated when you see it at the outset. So, however, let's know more about it. Let's know more about OCD. So, OCD, as I have already covered in the last session, see, OCD is obsessive compulsive disorder. It is a chronic mental health condition characterized by the presence of obsessions and compulsions. Obsessions are unwanted, intrusive, and distressing thoughts or images or urges that continuously occupy the individual's mind. And compulsions are the repetitive behaviors or mental acts performed in response to the obsessions to alleviate anxiety or prevent perceived harm. So, despite recognizing that these obsessions and compulsions are excessive or irrational, individuals with OCD find it difficult to control or stop them. So, this causes significant distress and interference with daily functioning. See, we have talked, this is OCD. So there are obsessions, there are compulsions, and few people suffer with obsessions, few people suffer with compulsions, few suffer with both. See, the obsessive compulsive disorder affects both males and females, but the incidence and prevalence rates can differ between gender, though it affects both. ओसीडी दोनों, मर्द और औरत को दोनों को इफेक्ट करता है, लेकिन प्रिवलेंस जो बोलते हैं, जो इंसिडेंस है, वो औरतों में थोड़ा ज्यादा है. Generally, OCD tends to be slightly more common in females than in males. However, the difference in prevalence is not substantial. So दोनों को हो सकता है, लेकिन जनरली थोड़ा प्रतिशत जो है औरतों में ज्यादा होता है. 3% of the world population is affected by OCD. So in 3%, it is usually 1.5 to 2.5% it is females, and 1% to 2% it is males. So ऐसे उनका क्लासिफिकेशन मतलब इंसिडेंस देखा गया है कि फीमेल्स में थोड़ा ज्यादा होता है और मेल्स में थोड़ा कम हो सकता है, लेकिन दोनों को हो सकता है ओसीडी. The prevalence of OCD in females is approximately 1.5 to 2.5% of the world population. And in males, the prevalence of OCD is slightly lower, ranging from 1% to 2%. So, and these prevalence rates suggest that OCD is relatively common in both males and females, affecting a substantial number of individuals worldwide. It's important to note that OCD can occur at any age, but it often starts in the childhood, adolescence, or early adulthood. See, OCD can occur in any age or in any stage of life, but usually it starts from childhood or adolescence or early adulthood, that is teenage years. या तो वो बचपन में शुरू होता है या तो वो टीनेज ईयर्स में शुरू होता है, from like 13 to 19, because this usually this starts from childhood only. So effects of OCD on mind and body. So what happens when a person has OCD to the mind? How does it affect body, and how does it affect mind? See here, the key point is that it may affect different individuals in different way. But these are, what I'm stating is generalized effects on the body and mind. So OCD can have profound effects on both the body and mind of the individuals experiencing the disorder. These effects can make vary depending on the severity of the symptoms and the individual's ability to manage them. Some common effects include, क्या क्या हो सकता है इसमें? So severity and intensity person to person, इंसान से इंसान को vary करता है. So anxiety and distress, the first thing which might happen. OCD is characterized by intense anxiety and distress caused by obsessions. ये obsessions or the unwanted thoughts. Because of the obsession and the unwanted thoughts, a person has intense anxiety and distress. So, the constant worry and fear associated with these thoughts can lead to chronic feelings of tension and emotional exhaustion. क्या होता है, अनचाही ऑब्सेशंस की वजह से एक इंसान को कॉन्स्टेंटली उसको वरी और डर, चिंता और डर होता है उसको, वरी एंड फियर एसोसिएटेड विद दीज थॉट्स. इस सोच की वजह से उसको वो हमेशा टेंशन में होता है और वो हमेशा इमोशनली एग्जॉस्टेड होता है. So, the constant worry and fear associated with these thoughts can lead to chronic feelings of tension and emotional exhaustion. So, इसके वजह से क्या हो सकता है? There may be physical strain. See, compulsive behaviors such as repeated hand washing, checking or counting can take a full toll on the body. For example, excessive washing, excessive cleaning, क्या होता है, can lead to skin irritation and dryness, while repeated checking can result in physical fatigue and soreness. Repeated checking if I have locked the door or not. Repeated checking if I have switched off the geyser or not. Repeated checking if I have turned off the stove or not, gas stove or not. All these, what happens is, eventually if you do it for 40 to 50 times or repeatedly with a repeated frequency, then what happens, it results in physical fatigue. इंसान थक जाता है, उसके वजह से इंसान थक जाता है। सो और कांस्टेंट क्लीनिंग की वजह से, हमेशा क्लीन करते रहने की वजह से, हाथ साफ करते रहने की वजह से थकान भी होते हैं, और हाथ जो है वो पूरा डल इरिटेटेड हो जाता है और ड्राई हो जाता है, और ड्राइनेस की वजह से अब हेल्थ प्रॉब्लम्स भी, स्किन प्रॉब्लम्स भी हो सकते हैं। So then it is disrupted sleep. What happens is OCD related anxiety and intrusive thoughts can interfere with sleep patterns. जब सोने का टाइम आए तब भी उनको एंजाइटी होता है, तब भी उनको वरी होता है, कांस्टेंट वरी एंड कांस्टेंट फियर, दे हैव बोथ. So OCD related anxiety and intrusive thoughts can interfere with sleep patterns, leading to difficulties falling asleep or staying asleep. Poor sleep quality can further exacerbate feelings of fatigue and irritability. So, because they don't get proper sleep, their feelings of fatigue मतलब थकान और इरिटेबिलिटी बहुत ज़्यादा रहता है, क्योंकि पुअर स्लीप क्वालिटी की वजह से उनको नींद प्रॉपरली नहीं होता है, तो उसकी वजह से फैटिग और इरिटेबिलिटी हमेशा ही रहता है उनको. And social isolation, the preoccupation with obsessions and the need to perform compulsions, can lead to social withdrawal and isolation. Individuals with OCD may avoid social situations to prevent their symptoms from being noticed or misunderstood. So, what happens is they are preoccupied with their thoughts, obsessions, and the need to perform compulsions, the behaviors. So, what happens? उनका सारा time उसी में चला जाता है. So, what they do is it leads to social withdrawal and isolation. They do not go to school or work or social gathering. They don't attend professional meetings or professional gatherings. So what happens is individuals with OCD may avoid social situations to prevent their symptoms from being noticed or misunderstood. उनको ये भी डर रहता है कोई इनका symptoms notice ना कर ले. People may find out that they have OCD and they have unwanted thoughts and fears. So this is also a fear again. And what happens with this impacts on relationship, obviously OCD can strain relationships with family, friends, and romantic partners. Loud ones may find it challenging to understand the behaviors and repetitive rituals, leading to frustration and tension in relationships. So what happens is there is frustration and tension in relationships as well, because they are people cannot understand them, people find it challenging to understand their behaviors and repetitive rituals, and they are also frustrated. In turn, there is impact on negative impact on relationships as well. So impaired functioning, here the productivity. So productivity also gets impaired. So OCD can significantly impact a person's ability to carry out daily activities and responsibilities. It may lead to difficulties at work or school, affecting academic and professional performance. Next is depression. इवेंचुअली क्रॉनिक, ड्यू टू बहुत वक्त से ये होता चला आ रहा है उनको, इसलिए दे हैव द क्रॉनिक नेचर ऑफ ओसीडी एंड इट्स इम्पैक्ट ऑन लाइफ, जो उनके लाइफ में हो रहा है, सोशल आइसोलेशन हो रहा है, रिलेशनशिप्स में इम्पैक्ट हो रहा है, प्रोडक्टिविटी इम्पैक्ट हो रहा है, तो इम्पैक्ट तो उनके लाइफ पे इम्पैक्ट हो रहा है. This can lead to feelings of hopelessness and depression in some individuals, because this may lead to depression. They will be constantly in depression, and then few people might also have some suicidal thoughts as well. It is very rare, but it also happens. And reduced quality of life. So eventually combining all those things, the combination of anxiety, intrusive thoughts, time consuming repetitive behaviors and rituals, what happens is this can significantly diminish the overall quality of life for individuals with OCD. क्वालिटी ऑफ लाइफ भी हैम्पर हो रहा है इसके वजह से. So it is important to seek professional help if you or someone you know is experiencing symptoms of OCD. Not only you, but if you know somebody who's experiencing these symptoms, proper diagnosis and treatment such as cognitive behavioral therapy, medication can help manage, improve symptoms and improve overall well-being. With appropriate support, many individuals with OCD can lead fulfilling lives and learn to manage their symptoms effectively. See, we have already discussed signs and symptoms, but just to give a brief recap to people who have missed, the signs and symptoms of obsessive compulsive disorder can be classified into two main categories. One is obsession, two is compulsion. It's important to note that everyone with OCD will experience all these symptoms, and severity of symptoms can vary person to person. Here are the signs and symptoms. See, obsessions may what all happens is obsession. Obsessions are intrusive, distressing, unwanted thoughts. People might have images or urges that recur persistently. So, what happens? These thoughts often cause intense anxiety and lead to attempts to ignore or suppress them. So, what are the common obsessions? Commonly, क्या obsession होता है? First is fear of contamination of germs. Next, unwanted thoughts of a harm coming to oneself or others. This is called checking OCD. They constantly check the door, constantly check the geyser, constantly check the gas stove and other appliances. And unwanted taboo thoughts or images. Any kind of unwanted taboo thoughts. Fear of causing harm to others accidentally, and fear of making a mistake or not being perfect. This is symmetrical OCD, where they want to arrange things in a perfect manner. And sometimes it will be like distressing religious or moral doubts. This also happens. They have anxiety and distressing religious and moral doubts about the religion, about the rituals of the religion, about the tradition. All these also may be a cause of OCD. These are obsessions. So, what are compulsions? Because of the obsession, to relieve that anxiety and stress, people are forced to do the repetitive behaviors or mental acts that individuals with OCD perform in response to their obsessions. These actions are usually intended to relieve, reduce anxiety or prevent feared outcomes, even though they are not connected realistically. So common compulsions: excessive hand washing or cleaning to prevent contamination, repeated checking of locks, appliances, switches to prevent harm, counting or repeating specific words or phrases, arranging or organizing objects in a specific way, mental rituals such as praying or counting to neutralize obsessions, avoiding certain places or situations that trigger obsessions. So, what happens next? What happens is feelings of distress and anxiety. And it is time consuming and interfering with life, obviously. Impairment in functioning. This impairs productivity. And what happens is, after this is the management of OCD. All these are the signs and symptoms. What happens? What are the obsessions? What are the compulsions? What happens? How does it impact your daily life? All that we have discussed. Now is the management. How to manage OCD, or how is obsessive compulsive disorder managed? See, the management of obsessive compulsive disorder typically involves a combination of evidence-based treatments, which may include psychotherapy, medication, and self-help strategies. But today we are discussing only on psychotherapy and self-help strategies, because my motto is to reduce and not to use medication wherever it is possible, and to treat the mental illness by only psychotherapy and self help strategies. This is my motto, my mission. So the aim of OCD is to management. OCD management is to reduce the frequency and intensity of obsessions and compulsions. First, what is the aim is to first to reduce in one go. We can't treat OCD. What we have to do, we have to go step by step, ladder approach. What we do is, first what we do is we try to reduce the frequency and intensity of obsessions and compulsions. Matlab, if a person is getting thoughts of contamination or germs, and he's going washing repeatedly for 30 times, we try to reduce it. Reduce the obsession time, reduce the compulsion, then reduce the compulsion. The 30 becomes 15, then the 15 becomes 10, 10 becomes 5. Like this, we can't do it at one go. The next thing is, what we do is, and improve daily functioning. When we reduce the frequency of obsession and compulsion, and a person has time for his daily functioning, for his daily functions, and to enhance the overall quality of life, this enhances the overall quality of life. ऐसे ही हम ट्रीट करते चले जाते हैं एक लैडर अप्रोच में. So what do we do? CBT, cognitive behavioral therapy, is usually the first line treatment for OCD. Cognitive behavioral therapy is a type of therapy used in OCD. I mean, is a type of therapy in psychotherapy. This is also used in a first line treatment in OCD. If you want to know more about CBT, I have made a complete session on CBT. You can refer that session. I'm coming up with another session of CBT sometime from now, but you can refer that session for information, for the detailed information on what is CBT. So, in CBT also, exposure and response prevention is the main technique used for OCD. Exposure and response prevention is ERP. So what is that? Is ERP is a specific form of CBT that exposes individuals to their obsessions or triggers. First we expose them to the obsession and the triggers while preventing them from engaging in their usual compulsive behaviors. They are exposed to their fears, but we stop them from washing hands, from checking repeatedly. So what we do, we tell them to do it mindfully. When you are checking once that the door is locked or not, if you are mindful at that time, you will not get fears that you have to go and check it once again. So mindfulness exercises also we do. So what happens here is, we, while preventing them from engaging in their usual compulsive behaviors, this is response prevention. First we expose and then response prevention. So, by facing their fears without engaging in rituals, individuals can, what happens is, learn their anxieties, uh, um, reduce over time, and they can tolerate the distress without acting on their compulsions. See, हम क्या करते हैं कि उनको बोलते हैं कि आपको आपको थॉट आने दो, फियर आने दो कि डोर लॉक नहीं है, या फिर गैस ऑफ नहीं है, लेकिन आप कुछ मत करो। आप कुछ मत करो, आप जाके बार-बार नहीं देखो, आप स्टॉप करो। आप माइंडफुली एक बार चेक करो, आप उसको स्टॉप करो, उस अर्ज को स्टॉप करो, बार-बार चेक करने के अर्ज को स्टॉप करो आप। उस टाइम पे हम कुछ और करने के लिए बोलते हैं उनको। सो दैट वो फ्रीक्वेंसी रिड्यूस हो जाए। वो 30 बार का धो के हाथ जाके धोना, या फिर बार बार क्लीन करना, बार बार चेक करना, बार बार चीज़ों को अरेंज करना, ये कम हो जाए. Then what we do is cognitive restructuring. What happens is, over a period of time, when the compulsions are reduced, द एंग्जाइटी एंड द स्ट्रेस इज ऑल्सो reduced. मतलब उनको पता चलता है कि वो सोचने लगते हैं कि मेरा फियर्स जो है, मेरा एंग्जाइटी जो है, वो इरेशनल है, वो एक्चुअली वो एग्जिस्ट नहीं करता, वो मेरे माइंड में है. And what we this is called cognitive restructuring. This aspect of CBT helps individuals identify and challenge their irrational thoughts and beliefs related to their obsessions. By modifying these thought patterns, they can gain a more realistic and balanced perspective on fears and anxiety. कॉग्निटिव रिस्ट्रक्चरिंग में क्या होता है, फर्स्ट हम क्वेश्चन करने के लिए बोलते हैं अपने आप को, आप इस एंजाइटी स्ट्रेस के साथ रोज जीना चाहते हैं क्या, या तो फिर आप कुछ बदलाव लेके आना चाहते हैं क्या अपने जिंदगी में। और जो भी करना है माइंडफुली एक बार करो, अपने आप को रिमाइंड करो कि मैंने ऑलरेडी चेक कर लिया है, इतना रिस्क नहीं है, मैं इतना टेंशन और स्ट्रेस लेके इस बारे में मैं नहीं बैठ सकता। इस तरह के ख़यालात कॉग्निटिव रीस्ट्रक्चरिंग, जो डर है उनके मन में, उसको एक्सपोज़ करते हुए उस डर को हम निकालते हैं, सो दैट द कंपल्शंस कम डाउन, सो दैट उनकी ओवरऑल क्वालिटी ऑफ लाइफ इम्प्रूव हो, एंग्जायटी और फियर कम हो। And next is mindfulness and acceptance based therapies. Therapies like mindfulness based cognitive therapy, MBCT, and acceptance and commitment therapy, ACT बोलते हैं उसको, can be beneficial for individuals with OCD. What these approaches do is, these approaches focus on increasing awareness of thoughts and feelings without judgment. सी दैट इज वॉट, व्हेन यू हैव, एक बार आपको ध्यान में रहे कि आपने डोर लॉक किया है, गैस बंद किया है, गीजर बंद किया है, आपने हाथ धोया है ऑलरेडी, आपने ऑलरेडी साफ कर लिया है, तो वहां पे जर्म्स होने के चांसेस नहीं है। तो बार बार धोने की जरूरत नहीं है, बार बार नहाने की जरूरत नहीं है। इस तरह से हम लोग क्या करते हैं, माइंडफुलनेस बेस्ड कॉग्निटिव थेरेपी एक्सरसाइजेस करवाते हैं, जर्नलिंग करवाते हैं, उनसे लिखवाते हैं कि मैंने साफ किया है सिंक को, मैंने साफ किया है इसको, मैंने चेक किया है। यू व्हेन यू जर्नल, व्हेन यू राइट, एंड व्हेन यू टेक इट लाइक that you have done, then the urge comes down. When the urge comes down, the behavior, repetitive behaviors comes down. So these approaches focus on increasing awareness of thoughts and feelings without judgment, as well as accepting the presence of obsessions and anxiety without attempting to control or suppress them. उन एंग्जाइटीज और फियर्स को कंट्रोल या सप्रेस करने की जरूरत नहीं है, उनसे डील करने की जरूरत है। हाँ, मेरा फियर क्या है कि कोई चोर अंदर घुस आएगा अगर मैंने डोर लॉक नहीं किया तो, लेकिन अगर मैं ध्यान रखते हुए डोर लॉक करूं, तो मैं उसे नोट कर लूं, तो मेरे पास है रिकॉर्ड कि मैंने डोर लॉक किया है। तो अननेसेसरी उसके बारे में मेरा जजमेंट कम हो जाएगा कि कोई चोर आ जाएगा अंदर, कुछ कर देगा, किसी को हार्म कर देगा, या फिर मैंने गैस ऑन ही रखा हुआ है तो मैं गैस कहीं बर्स्ट ना हो जाए, गैस स्टोव सिलेंडर कहीं बर्स्ट ना हो जाए, या फिर गीजर कहीं बर्स्ट ना हो जाए। इस तरह के डर को आप माइंडफुलनेस एक्सरसाइजेस से आप कंट्रोल कर सकते हो। मतलब एंजाइटी को और फियर को सप्रेस करे बिना उससे डील करना सिखाता है। This acceptance allows individuals to make room for their distressing thoughts without letting them dictate their behaviors. और क्या करते हैं हम, थॉट्स और कंपल्शन, ऑब्सेशंस और कंपल्शन का कनेक्शन हम तोड़ देते हैं। क्या होता है, इसको तोड़ने के बाद what happens is, then a person becomes more mindful, एंड उसका ऑब्सेशन के साथ कंपल्शन रिचुअल टूट जाता है उसका काफी हद तक। तो उसका इमोशनल वेलबीइंग और होलिस्टिक वेलबीइंग भी होता है उसके साथ, और ही इज एबल टू लीड हिज लाइफ मोर नॉर्मली, एंड इट improves his quality of life. And what is the next thing is support groups. See, joining support groups with others who have OCD can provide a sense of understanding, validation, and encouragement. क्या होता है, ऐसे ही सपोर्ट ग्रुप्स होते हैं, ओसीडी सपोर्ट ग्रुप्स, सपोज आपको एंग्जाइटी है, एंग्जाइटी सपोर्ट ग्रुप्स, स्ट्रेस सपोर्ट ग्रुप्स, ऐसे बहुत सारे सपोर्ट ग्रुप्स होते हैं। वंस यू कंसल्ट योर a psychotherapist or a psychiatrist, they will guide you about this. What happens is, there will be people who are like minded, who who face the same problems. When you share experiences and when you mingle with them, you also share the coping strategies with the peers. So sharing experiences and coping strategies with peers, or the people who have the same problem, who can relate to the challenges of OCD, can be helpful in reducing feelings of isolation. वो सोशल आइसोलेशन है, उसको ब्रेक करने में मदद करता है। क्या है, जिनको ओसीडी नहीं है उनको ओसीडी समझना बहुत मुश्किल है, पर जिनको ऑलरेडी ओसीडी है वो दूसरे ओसीडी पे दूसरे पर्सन का ओसीडी आसानी से समझ सकता है। दे कैन शेयर देयर एक्सपीरियंसेस, दे कैन शेयर देयर ट्रीटमेंट पैटर्न्स, दे कैन शेयर देयर थॉट पैटर्न्स, जो भी उनके मन में चल रहा है वो। Next main important thing is, we tell them to do some lifestyle modifications. So lifestyle modifications is also very much important. Adopting a healthy lifestyle can contribute to managing OCD symptoms. Like, we tell them to add some regular exercises. First, next important thing is proper sleep, balanced diet, stress reducing techniques, उनको stress reduction techniques which can help alleviate anxiety and overall well-being, ये सब हम लाइफस्टाइल में चेंजेस लेके आते हैं। सो दैट एक्सरसाइजेस हो गया, मेडिटेशन हो गया, एक प्रॉपर स्लीप हो गया, एक प्रॉपर वर्क लाइफ बैलेंस हो गया। सो ऑल दिस इज स्ट्रेस रिडक्शन के लिए स्ट्रेस रिडक्शन टेक्निक्स हो गया, योगा, प्राणायामा and pratyahara, and avoiding self reassurance and rituals. Individuals with OCD often seek reassurance from themselves or others to alleviate anxiety. Avoiding self reassurance and gradually reducing ritualistic behaviors can be challenging, but it is an important step in breaking the OCD cycle. What happens is, when a person has OCD, why he does the compulsive behaviors is because of his thoughts and obsession. So what he does is, after he does that compulsive behavior, always he reassures himself, अरे भाई मैंने हाथ धो लिया, अब मैं मुझे कुछ देर तक मुझे जर्म्स मुझे परेशान नहीं करेंगे, अरे भाई मैंने चेक कर लिया, अभी डोर लॉक्ड है, यू नो व्हाट, अभी चोर नहीं आ सकता। वो एक टेम्पररी सेल्फ रीअश्योरेंस है, वो बार बार रिपीटेडली उसको करते रहते हैं। उसकी वजह से क्या होता है, कंपल्सिव बिहेवियर्स जो होते हैं वो ज्यादा हो जाता है। So if we break that self reassurance and we avoid that self reassurance and ritualistic behaviors, वो भी एक OCD cycle को break करने में help करता है। See, avoiding self reassurance and gradually reducing ritualistic behaviors can be challenging, but it is an important step in breaking the OCD cycle. And setting realistic goals. Gradual progress is a key. I step by step, ladder wise, okay, is key. When managing OCD, setting small, achievable goals and celebrating successes can boost motivation and confidence in overcoming the disorder. So setting realistic goals, उनको हम realistic goals set करने को बोलते हैं। क्लीनिंग हो गया, दिन में एक बार क्लीन कीजिए, दिन में एक से दो बार बेथ कीजिए, दिन में 5 से 6 बार या 7 बार आप हाथ धोइए। चेक करना भी, आप अगर आप घंटे में 10 बार चेक करेंगे तो घंटे में 1-2 बार चेक करने के लिए बोलते हैं। दिस इज अ ग्रेजुअल थिंग, कीप रियलिस्टिक गोल्स एंड reduce it gradually। और उनको सबको हम रिकॉर्ड करने के लिए बोलते हैं जर्नलिंग में, आज आपने कितने बार किया, सो दैट व्हाट हैपेंस इज दैट इज माइंडफुल। Oh yes, I have done this and that. To reduce it, systematically, gradually and slowly. Gradual progress is a key here. So, and celebrating success, अगर उन्होंने compulsive behaviors थोड़ा कम किया, rituals कम किया, तो उसको रिवॉर्ड करना, सब उसको सेलिब्रेट करना, उसको खुशी मनाना भी क्या होता है, दैट कैन बूस्ट मोटिवेशन एंड कॉन्फिडेंस इन ओवरकमिंग द डिसऑर्डर। See, that helps setting small achievable goals and celebrating successes. See, मैं आज सिर्फ 6-7 बार ही हाथ दूंगा, पहले मैं 30 बार धोता था, अभी मैं 6 या 7 बार ही दूंगा. आफ्टर he completes the 24 hours with that 6 or 7 times, we help in celebrating the success. Rewarding, एक छोटा सा रिवॉर्ड, आज मैं ये खा सकता हूँ, can boost motivation and confidence in overcoming the disorder. This helps in, overcoming the disorder eventually. ये सब एक दिन में नहीं, it is not a one day process. सो रिलैप्स प्रिवेंशन, ये सब कुछ करने के बाद क्या हो सकता है, कुछ टाइम बाद अगर आप थेरेपी स्टॉप कर दे, या हो सकता है कि ये सिर्फ ओसीडी फिर रिलैप्स हो. इसका कोई गारंटी नहीं है कि रिलैप्स नहीं हो सकता. इसलिए relapse prevention is also very important. OCD is a chronic condition and relapses can occur. Learning relapse prevention strategies and having a plan in place. We tell them to plan every day, plan the day ahead, and they have to have the plan in, plan ahead. So plan in place to address any resurgence of symptoms is crucial in maintaining progress. So it is very important that we prevent relapse of OCD. So, यहाँ पे भी it's essential to work with a qualified mental health professional experienced in treating OCD. The therapist can tailor the treatment approach according to the, individual specific needs. Yes, customizable approach होता है. हर एक इंसान को अलग ओसीडी जिनको होता है, अलग अलग ओसीडी के इंसान को अलग अलग सिम्टम्स होते हैं, और ट्रीटमेंट्स दे नीड स्पेसिफिक नीड्स एंड हेल्प देम डेवलप effective coping strategies. So, with proper management, individuals with OCD can experience significant improvement in their symptoms and enjoy a better quality life. So, as I said, these are the, and all these सेल्फ हेल्प स्ट्रैटेजीज में भी एजुकेशन. फर्स्ट सेल्फ हेल्प स्ट्रैटेजी में क्या है, एजुकेशन मतलब you have to know what is OCD, learning about the OCD, what may be the signs and symptoms in the OCD, and its nature, and what are the treatment options, what are the causes, everything must be known. As I said, you have to attend the support groups, stress management, you have to see the sleep and nutrition. There is a technique called deep brain stimulation. So for severe and treatment resistant cases, DBS is a surgical options where electrodes are implanted in specific brain regions to modulate abnormal neural activity. This treatment is typically considered when other therapies have not been successful. This is in the rarest of rare case, that is called deep brain stimulation. It is a surgical intervention. So, let's know what is full OCD cycle with treatment. Let's understand with one or two case studies here. See, the OCD cycle is a repetitive patterns of thoughts, feelings, and behaviors that individuals with OCD experience. It involves four main components: obsession, anxiety, compulsion, and temporary relief. इस साइकिल में 4 चीजें होती है. एक ऑब्सेशन, थॉट्स की वजह से ऑब्सेशन. दूसरा है एंजाइटी एंड स्ट्रेस. तीसरा है कंपल्सिव बिहेवियर्स, दैट इज कंपल्शन. फोर्थ इज टेम्पररी रिलीफ. सो ऑब्सेशन एक साइकिल के थ्रू we will see this, and with a case study. See, case study is, let's consider a parrot here. Okay, Parrot is a client. Let's presume Parrot is a client. Parrot is a 28-year-old woman who has experiencing distressing obsessions related to contamination. She has a contamination fear, that is germophobia also. That is known as germophobia as well. So she is particularly afraid of contracting a severe illness from germs and believes that she must keep everything around her clean to prevent harm to herself and her family. So she is feared of contracting a illness, an infection from germs. So what she does is she wants to keep everything clean to prevent harm to herself and her family. So what we do is, once we know of her obsession and her compulsion is, she often tend to wash her hands, she bathes frequently, she cleans the house frequently, and she arranges the things perfectly. What happens is, while she is doing everything, her life becomes, less productive. She is not able to manage her daily routine as she was managing earlier. So, what we do is, first we have to assess and we psychoeducate her. Psychoeducation. The therapist first conducts an assessment to understand parrot's symptoms. What are the symptoms? What are the triggers? And what is the impact of OCD in her life? How is it impacting her life? That is the important thing. They educate parent about OCD. So first, education about OCD is important. Explain that the obsessions and anxiety are not indicative of her true self, and the OCD is very much treatable, and the fears are, completely irrational. So once we do that, we start identifying the triggers and obsessions. So parent and the therapist work together here to identify specific triggers that lead to her contamination obsession. Triggers could be touching doorknobs, using public restrooms, handling items, or taking baths frequently, washing hands frequently, cleaning frequently. And she does not touches the doorknobs that others have touched because she fears of contracting an infection. All this we identify triggers and developing a hierarchy. So treatment hierarchy, see what can be done. The therapist helps parent create a hierarchy of feared situations based on their level of anxiety. For example, touching the doorknob with her bare hand might be at the bottom of the hierarchy, while touching public restroom surfaces might be at the top. See, what is the first fear? Is first fear might be for her is she is very much afraid, to afraid of touching public restroom surfaces. That is the first fear of hers. Second is touching the doorknob. Next is using the sink. And next is she feels that sink is also having germs with the contamination fear. And she feels that the floor is contaminated. So all these triggers, but in one person, one fear is the most scary fear and the least scary fear. So developing a hierarchy, जिससे उनको बहुत डर लगता है उसको फर्स्ट हम एड्रेस करते हैं, ना कि जिससे उनको कम डर लगता है। एक हायरार्की डेवलप करके उसको हम एड्रेस करते जाते हैं। एंड एक्सपोजर एंड रिस्पॉन्स प्रिवेंशन। सो एक्सपोजर, उनको हम उस डर के सामने एक्सपोज करते हैं, उनको डोर नॉब हम छूने के लिए कहते हैं, पब्लिक रेस्टरूम के डोर नॉब को छूने के लिए कहना, सिंक को छूने के लिए कहना। लेकिन रिस्पॉन्स प्रिवेंशन, प्रिवेंटिंग द रिस्पॉन्स, दैट इज व्हाट शी डज, वॉशिंग हैंड्स, this we tell her to prevent. So parrot begins the exposure exercises starting with the least anxiety provoking situation. पहले हम लीस्ट एंजाइटी प्रोवोकिंग सिचुएशन को हम लेते हैं पहले, एंड वी प्रोसीड टू द हाईएस्ट वन. So the therapist encourages her to expose herself to the trigger, that is touching the doorknob without engaging in the usual compulsion. Instead, she practices sitting with the anxiety until it naturally subsides. See, उनको हम बोलते हैं कि आप तब तक उसको आप हाथ नहीं धोएंगी जब तक आपका एंजाइटी खुद कम नहीं हो जाता, खुद टेम्पररी रिलीफ नहीं मिल जाता। ऐसे हम एक्सपोज करते हैं और रिस्पॉन्स प्रिवेंशन करते हैं, मतलब जो कंपल्सिव बिहेवियर्स होते हैं उनको हम प्रिवेंट करने की कोशिश करते हैं। And managing anxiety, see, the therapist teaches parrot relaxation techniques and mindfulness to help her cope with the anxiety during exposure exercises। ये भी किए जाते हैं कि थेरेपिस्ट क्या करते हैं, पैरेट को रिलैक्सेशन टेक्निक्स एंड माइंडफुलनेस टेक्निक्स, जैसे मैंने पहले कहा था, वो करवाते हैं ड्यूरिंग द एक्सपोजर एक्सरसाइजेस। और ये सब क्या होता है, जनरली ये सब इट इज ऑल्सो इन फ्रंट ऑफ द mental health professional in the beginning, because we have to see the progression, and we see the gradual progression as parent gains confidence in facing the less distressing triggers। एक बार उनका जो छोटा वाला डर है ना, उसको एड्रेस करने के बाद उनको एक तरह से एक कॉन्फिडेंस आता है। उसके बाद हम क्या करते हैं, बड़े बड़े डर को हम फेस करने के लिए उनको एक्सपोज करते हैं। As Sarah gains confidence in facing the parrot, gains confidence in facing less distressing triggers, she moves up the hierarchy, gradually exposing herself to more challenging situations without giving in to compulsions। नेक्स्ट क्या होता है, व्हाट वी डू इज चैलेंजिंग कॉग्निटिव डिस्टॉर्शंस थ्रूआउट द थेरेपी। द थेरेपिस्ट हेल्प्स पैरेट आइडेंटिफाई एंड चैलेंज कॉग्निटिव डिस्टॉर्शंस रिलेटेड टू हर कंटामिनेशन फियर्स। थ्रू आउट द थेरेपी हर बार एक फियर को आइडेंटिफाई करना, उसको चैलेंज करना, उसके लिए एक्सपोज करना, और उसका रिस्पॉन्स प्रिवेंट करना, ये करते ही जाते हैं। दिस इज रिपीटेड प्रोसीजर। शी लर्न्स टू रिकॉग्नाइज व्हेन हर थॉट्स आर इरेशनल एंड टू reframe them more realistically, and we tell her to think whether her fear is actually true, or it is just irrational in her mind, it is just imaginary। Once she becomes more mindful of it, once she journals it, once she starts writing it, what happens is she realizes, oh, ये डर सच्चा है, ये डर झूठ है, ये डर सिर्फ मेरे मन में है, ये एक्चुअली है ही नहीं। Then is the relapse prevention। So parent and a therapist work on relapse prevention plan to ensure she can maintain progress after therapy ends। So this plan includes coping strategies for managing any future OCD related challenges। एक बार पूरा ट्रीटमेंट खत्म होने के बाद, सेशंस थेरेपी सेशंस खत्म होने के बाद, we teach her relapse prevention techniques। So, over time, with consistent ERP exercises and cognitive restructuring, parrots' anxiety and need to engage in the compulsion decrease significantly. She learns to tolerate uncertainty and accept that her obsessions do not dictate her actions। See, she is not, we break the cycle of, as I said, obsession and compulsion. She gets to know that, she is not in control of her obsession. Her compulsions are not in control of the obsession। मतलब एक एंजाइटी, एक फियर होते हुए भी वो कंपल्शन को प्रिवेंट करते हैं, हम लोग अवॉइड करते हैं। So she learns to tolerate uncertainty and accept that her obsessions do not dictate her actions। Through the therapy process, Sarah has gained valuable skills to manage her OCD, leading to significant improvement in her quality of life। What happens is there is a significant improvement in the quality of her life। So this is one example case study। So this is one example. I will come up with some more examples in the in my next session of OCD। So that's it for today, and thank you for staying tuned। I am coming up with new topics every week, if you want me to address any topic, any mental health condition, any you want information on any aspect of Ayurveda or mental health condition, please let me know in the comment section, and let me know what you feel of the session in the comment section. And thank you for staying tuned. Namaste.